Hey guys, so as you can tell, I'm at work and I am coming to you with a weird topic tonight. This is my last night on night shift, and yeah, I just want to ask you guys because I saw somebody talking about this in my nursing forum that I go on sometimes. I haven't really been on there as much recently as I used to, but so they were talking about, would you clean up after a patient who has masturbated? Like, obviously with dementia, when they do that, it's a little bit different than somebody who knows exactly what they're doing and does it and then expects you to clean up after them. Like, if somebody's in their right mind and chooses to masturbate and get bodily fluids everywhere, which is completely gross, would you have an issue cleaning them up afterwards if they are in their right mind and know exactly what they're doing? Like, I've worked in a place where there were a couple people who did this, but they had dementia. So it wasn't like, they knew exactly what they were doing and they knew that it was inappropriate. Like, they had dementia, so it's a little bit of a different type of situation when you deal with people who have dementia, obviously. So I feel like, obviously, people with dementia don't necessarily know that something is inappropriate. They don't necessarily know that it's not okay to do. I'm not saying that it's not okay for them to do that, because it is a normal, everyday thing that human beings choose to do. And obviously, just because someone is in a nursing home or a long-term care facility, that doesn't mean that they are not entitled to masturbate or have sex if, they have a consenting partner and the family's consent and all of that stuff. But would you have a problem cleaning it up? I think, if the person is in their right mind and knows what they're doing and chooses to do that anyway and then make you clean it up, I think I have a problem with that then. But like I said, with dementia, they don't necessarily understand that it's inappropriate. They don't necessarily get, like, I don't know. It's just kind of like a gray area. I'm just curious to see, like, what you guys feel about this. Would you do it? I mean, obviously, if it's part of patient care, you would have to do it because you have to clean them up and you have to make sure that their bed is clean and all of that stuff. But would it gross you out having to do that for somebody? Like, I don't know. I just feel like it's one of those weird gray areas that nobody really wants to be in. I'm kind of glad that I don't have any residents or patients that currently do that. But, obviously I've dealt with it before. I don't know, it's just weird. What would you do? What would you do if you walked in and you saw that somebody had done that and there was a mess everywhere? Especially if they did it, like, regularly. I don't know. I don't know how I would feel about that. Like, if somebody did it regularly, I would feel like they were doing it on purpose just to try to piss me off or just to try to see if I'm gonna, not clean it up or, say something to them about it. I don't know. I feel like maybe they're trying to trap you or trick you into, flipping out or something. I don't know. But what would you do in this situation? Would you just deal with it, clean it up, and move on with your day? Or would it bother you? It would definitely bother me. I mean, I still think it's gross, even if the person has dementia, don't get me wrong. I still think it's gross, but it's a little excusable if they have dementia because they don't necessarily understand. Now, if the person doesn't have dementia and they understand what it is that they're doing and that it's inappropriate to have somebody else clean that up, that's a different story. So what would you do? Let me know in the comments below. Have you ever had to clean up after someone who has masturbated? Let me know.